Australia beat the world on shutting out COVID. Now it is bitterly divided on how to reopen. CNN, an increasingly frustrated Australian Prime Minister Scott Morrison turned to the animated film last week to drive home his point that the country needs to reopen, COVID or no COVID. It's like the movie The Cruise, he said, referring to the 2013 movie about the prehistory family forced to leave their home. People want to stay in the cave, we can't stay in the cave and we can get out of it safely. Since then, debate on the issue has descended into a less than the family-friendly slinging match between states over a national plan to open internal borders before Christmas. The problem is not all of Australia is keen to leave the cave so quickly. In Australia's largest eastern cities of Sydney and Melbourne, rising COVID-19 infections have led to months-long lockdowns and strict rules on who can travel interstate. Businesses are suffering, families are split, and the ongoing uncertainty is taking a toll on people's mental health. Yet, in parts of the country that have managed to contain COVID-19, including the states of Western Australia and Queensland, there is little appetite to open borders and allow the virus in. After 18 months of basking in their success in keeping COVID out, Australian politicians are now being forced to pivot from a zero COVID strategy to living with the virus. The question is how they can convince the Australians to support the national plan when some of the states' own leaders are in revolt, with one state's premier calling the plan conflict madness. People are seen crossing a quiet Flinders Street on September 1st, 2021 in Melbourne, Australia. Inevitable. For a while, along with neighboring New Zealand, Australia's success made it the envy of much of the Western world. As global COVID case numbers and deaths soared, Australia mostly kept itself COVID-free. Australian government shut the country's borders in March 2020, shortly after the first global outbreaks began, and since then any infections inside the country have been stamped out with fierce restrictions until June. Then, Australia suffered a major outbreak of the highly contagious COVID-19 Delta variant in New South Wales, the state in which Sydney is the capital. August saw record case numbers in Australia. Amid the outbreaks of the infectious Delta variant in mid-2021, reported COVID-19 infections jumped to their highest levels yet after 18 months of the relative control. The local government initially set light restrictions, but as cases continued to explode, they had no choice but to impose the lockdown. Since then, infections have spread to Melbourne in the states of Victoria and then to the national capital, Canberra. As of Friday, more than half of Australia's population of 25 million people are under lockdown, including the entire populations of 3 states and territories in New South Wales, Victoria, and ACT. Faced with growing economic pressure, rising case numbers, and violent anti-lockdown protests, Morrison announced the beginning of the end of Australia's zero-COVID policy on August 2022. Video shows anti-lockdown protesters crash with the police in Australia. He wants Australians to follow the lead of the United States, the United Kingdom, and the European Union, which have started to embrace the living with COVID, using vaccines to reduce hospitalizations while allowing a version of free travel. Under Australia's national plan, the country will reopen with limited restrictions when at least 70% of eligible people have received 2 vaccine doses. However, the country has struggles to vaccinate its population due to the lack of urgency and inadequate supplies. As of Friday, about 37% of people over the age of 16 in Australia had received 2 doses, compared to at least 60% in the US and more than 78% in the UK. The Australian plan, a version of which was previously agreed to by each state and territory, was based on the modeling by the Doherty Institute, an infectious disease research body. The institute estimates that with adequate vaccine coverage and moderate restrictions, Australia could reopen to the world with fewer than 100 deaths in 6 months. This is what living with COVID is all about. The case numbers will likely rise when we soon begin to open up. That is inevitable, Morris wrote in an opinion piece distributed to the local media. Hundreds of people wait in line for their COVID-19 vaccine at the Southwestern Sydney Vaccination Centre at Macquarie Fields on August 19 in Sydney, Australia. Reopening pushback. In his clinic in Perth, General Practitioner O'Donovan said a lot of his patients, particularly elderly people, are nervous about a potential COVID-19 outbreak in Western Australia. Those salt up people are very afraid of opening. They are worried about what will happen, and people are telling them left, right, and center that COVID is going to get in here, and we're going to be a hit with it, as bad as New South Wales, O'Donovan said. There is a great deal of fear. Australia is divided over its COVID-19 strategy. Outbreaks in the 2 largest states, New South Wales and Victoria, as well as in the Capital Territory, led to new strict lockdowns, while states that have been reluctant to open their borders are still relatively unaffected by the pandemic. The states of Western Australia, South Australia, Queensland, and Tasmania have managed to keep COVID-19 cases close to 0, and as a result, their leaders have been less keen to embrace the Morrison's push for open borders. Western Australia Premier Mark McGowan said reopening prematurely to deliberately import the virus would be complete madness. We currently have no restrictions within our state, a great quality of life, and a remarkably strong economy which is funding the relief effort in their part of the country, McGowan posted on Facebook. West Aussie just one decision that considered the circumstances of all states and territories, not just Sydney. Queensland Premier Anastasia Palaszczuk conceded that COVID will likely penetrate the state borders, but she demands more detailed modeling about how opening up would affect unvaccinated children. Rather than picking fight and attacks, let's have a decent, educated conversation, and there is nothing wrong with asking decent questions about the safety of families, she said, after being accused of mongering by only focusing on the worst case scenario of death. The Australian Medical Association appears to agree with the reluctant state leaders, warning in a letter to Prime Minister Morrison that Australia's health system was not ready for a major COVID outbreak, vaccinations or not. Our hospitals are not starting from a position of strength, far from it. Dr. Omar Khourshid. If we throw open the door to COVID, we risk seeing our public hospitals collapse, and part of this stems from a long-term lack of investment in public hospital capacity by state and federal government. AMA President Dr. Omar Khourshid said in a statement, "Our hospitals are not starting from the position of strength, far from it." Speaking on Friday, Morrison said the government was examining the Australian hospital system's ability to cope with the COVID infections ahead of reopening, and that preparation that had been underway for some time. Local residents walked over the bridge on August 4th in Brisbane, Australia. Lockdown fatigue. Melbourne restaurant owner Luke Stamsey has had both doses of the COVID-19 vaccine, but when he ran out of milk on Tuesday night, he couldn't leave his house to get more. It was already past Melbourne's 9 p.m. curfew. "I'm fully vaccinated and tonight I'm locked up like a caged animal," he said. Since the beginning of the pandemic, Melbourne has spent more than 210 days in a hard lockdown, the longest of any Australian city, and the stress is starting to show. I've had countless days where I would give anything to make this go away, Stamsey said. "You just feel so confused, so depressed. You just don't have answers. I've got to be strong for all of my staff. I've got to be strong for all my family, but internally, I'm just burning alive. I've got to be strong for all of my staff. I got to be strong for my family, but internally, I'm just burning alive." Luke Stamsey. On August 5th, state authorities ordered Victorians into lockdown after a small number of cases crossed the border from New South Wales. Citizens are allowed to leave their homes only for essential reasons, such as to buy groceries. Stamsey said his restaurants had remained solvent due to a last-minute decision in March 2020 to forego a large business purchase, leaving him with substantial savings. But he said the hospitality industry as a whole had been smashed. I have a friend in Las Vegas who has a restaurant, and he said to me, Dude, did you shut down for 5 cases? Stamsey said. Just across the border, New South Wales is recording more than 1,000 new daily COVID-19 cases, the highest numbers Australia has seen since the beginning of the pandemic. The leaders of New South Wales and Victoria have embraced Morrison's plan to move away from a zero COVID strategy, with both promising more freedom to citizens once certain vaccine targets are reached. On Thursday, New South Wales became the first Australian state to reach 70% first dose vaccine coverage, and residents are now allowed unlimited exercise in certain areas. Melbourne-based epidemiologist Tony Blakely said Australia's zero-COVID strategy was only ever a stopgap measure until enough of the population was vaccinated or new treatment were discovered to make it safe to to live with COVID. He said living with zero COVID in the long term isn't sustainable, but any reopening needs to be carefully managed, he said, suggesting the country should ensure all communities, particularly vulnerable ones, are 70% vaccinated. If you open up and the vaccine coverage in those areas is only 40% and it's 90% elsewhere, you've got a real problem, he said. We're just on Iceland that stopped the flight. With the bickering and the furring, it's not clear what will happen once Australia's vaccination targets are met. It could be that some Australian states open up to the rest of the world before people are allowed to drive from one state to another. You could have the ridiculous situation where someone in New South Wales could travel to Canada before they could go to Cairns, or someone in Victoria could travel to Singapore or Bali before they can go to Perth. Treasurer Josh Frydenberg said Monday. Someone in Victoria could travel to Singapore or Bali before they can go to Perth. With its eyes on the economy several months out from an election, the federal government wants the country to reopen so Australia can leave its cave and rejoin the rest of the world. On Wednesday, Australia's Attorney General Michaela Cash appears to threaten legal action to force the states to open their borders. However, Cash later claimed she was misinterpreted, suggesting the federal government wants to avoid appearing like it's bullying the state to do its bidding. In Victoria, Stamps is skeptical of promises that life will be freer once the state emerges from lockdowns. He thinks the moment there is a major outbreak, the local authorities will once again pull the lockdown trigger. I think they back up themselves into a corner trying to be a world beaters, he said, referring to Australia's past success in keeping COVID out. Australians sat back, beating their chest. Look at us, we're smart. We beat the virus, we're not smart, we're just Iceland that stopped the flight.